Today as well, we will talk about illicit drugs and your mental health. That is illicit drugs and your mental health. The truth be told, these days it has been said that a lot of persons out there have abused drugs, so much so that a lot of persons are so affected. With illicit drugs all over the world, not just Nigeria. But however, Nigeria is our main concern. Nigeria is our home. Lagos is our home. Ikorodu is our home. So we'll have our focus today around illicit drugs and mental health. We're going through the records. The 2023 World Drug Report, launched by the United Nations Office on Drugs and Crimes, has actually said that a lot of persons are rated to about 13.2 million persons globally are actually affected by drugs abuse in the world, globally rather. And this was for the year 2021. At the same time, it was also said that in the year 2022, that increased up until 296 million of persons that actually basically abuse drugs. Now, when we look at these figures, we see that gradually the situation of drug abuse is becoming so rampant. So a day such as 26th of June was set aside, and it was called the International Day Against Drug Abuse and Illicit Trafficking, which happens to be a Monday. International Day Against Drug Abuse and Illicit Trafficking was the day that was set aside to create a proper awareness, a proper publicity for the general public to stay out of drugs. This also will be our conversation today as we have the Ikorodu General Hospital with us in the studio. You would recall that sometimes ago, talk about from the beginning of this conversation, we had members, officials from NDLEA to talk to us about how terrible drug abuse has actually messed the society up. You would also recall that precisely on Tuesday again, we had members from the Ikorodu Youth Ambassadors. Youth actually joined us in the studio to also talk about their experiences within the society, the community, on how youths around abuse drugs a lot. And this has even gone down to secondary schools, and it has become, gradually, it is becoming the order of the day, which should not be. Today with me in the studio, I have from General Hospital Ikorodu, talk about the Department of Mental Health, General Hospital Ikorodu, a mental health practitioner in person of Dr. Isaiah Kanu. Dr. Isaiah Kanu is a senior registrar and a physician from General Hospital Ikorodu. He will do justice to the conversation, illicit drugs and your mental health. My name is Okpeyemi Adebambo. We're going a very short breather. When we return, we begin the conversation on the issues. Good morning to you. You're welcome back to the issues on IKD 106.1 FM. I told you that statistics shows that over 116 million persons by figures in this part of the world are actually involved in drugs. Now the figures increased to about 296 million globally, which rates to about 23% of the global population. This is very terrible, I must tell you. And we've decided to bring in a doctor today to tell us the dangers that are in line with what we call illicit drugs. The dangers that are attached to when we take these substances that we feel will make us fly. Let me use that word. These are substances that a lot of us would think it is actually doing us good. But the truth is, it is doing us more harm than good. With me in the studio, we have Dr. Isaiah Kanu from Ikorodu General Hospital. I told you he's a mental health physician. He sure knows his onion so well. And we together, we would have the conversation today. Good morning to you, sir.
Good morning to you, my director.
It's good to have you in the studio.
Yeah, same here. Thank you for having me.
And I want to say thank you for joining us too.
Yeah.
So today we want to talk about illicit drugs and the mental health. Now, the first question I would like us to tackle first is when we talk about this day that was set aside, which happens to be on a Monday, 26th of June, it is termed as International Day Against Drug Abuse and Illicit Trafficking. Can you help us shed a little bit of light on this day, the essence of this day, why there was an establishment for such a day called International Day Against Drug Abuse?
Yeah, very good. All the statistics, the sister you read out showed that drug abuse, drug problem has become a real menace world over, not only in Nigeria. And the prevalence, the number of people using them have continued to increase, skyrocket. and it has to do with all the challenges. You know, challenges in the world of today, okay, are getting bigger, more, and people are embracing drug. And most times when people use drug, okay, they use it to cope with the challenges, life stressors, and that's not a good coping mechanism. It's a maladaptive coping mechanism. Now, the day was set aside by United Nations Office of Drug and Crime, okay, with aim to strengthen action and cooperation in achieving a world free of drug abuse. And the theme for this year actually was people first, or was people first. People first. You know, in African or Nigerian adage or proverb, we say you don't throw away a baby with the bathwater. Yeah. So, you know, people first. Fine, it's good to fight crime. Give it a human first. These are human beings, okay? They need help. They need empathy, all right? So, people first, stop stigma and discrimination, strengthen prevention. The aim of this year's campaign is to raise awareness about the importance of treating people who use drug with respect and dignity, providing evidence-based voluntary services for all, and offering alternatives to punishment. Now, years back, all right, there was this, okay, people who abuse substances, who use drug. Okay, is it a social problem? Is it a medical problem? Okay, fine, it's easy. They are flogged even abroad, even somewhere like UK some years ago. Okay, they think, okay, they don't have willpower. There are social liabilities, because when people use drugs for a long time, they become also irresponsible, if you know what I mean. They don't attend to the things they are supposed to attend. So they do corporal punishment, all sorts of things, imprison them. But there are more to that. As people use drugs, I'm just saying things generally.
Yes, please.
As people use drugs, it now affects their brain, reprograms their brain. It becomes a medical problem. They need help. So I will use this opportunity to appeal to a body like NDLA. While they are busy, they are doing a good work. They are doing some good work right now. Okay, fine. Punitive measures are not the only measures. These people also need help, especially those that use it, apart from those that traffic, okay, make money. Okay, NDLA should plan. I don't know whether they are doing that now. Plan to establish good rehab centers. Work with experts in this field. Rehabilitate these people. Show empathy. Prioritize prevention. Okay, part of the team this year is to prioritize prevention. You know, they say prevention is better than cure. That is true in every sector, every realm, especially in drug abuse. Okay, because when people start, it's better prevented. When people start using it, okay, especially when they started early, become heavy users, and for a long time, all right, it affects their brain. We are going into that.
Yes, definitely.
Answering your question.
Yes, definitely.
So, prioritize prevention, bleeding with compassion. The campaign also aims to end stigma. This year's theme, end stigma and discrimination against people who use drugs by promoting language and attitudes that are respectful and non-judgmental. So this year's World Drug Day is a call to raise awareness. Raise awareness about the negative impact of stigma and discrimination on people who use drugs and their families. People tend to just stigmatize them, okay, never do well, they're still human beings. They need help. All right, they need help. They may have made mistakes. They have, okay. Now, well, let's say use that word, genesis of drug use, you know, okay, they are multifactorial. All right, okay. Why using people can use drug? We call it initiating the behavior. Okay. A lot of things. It can be peer pressure. It's common among the youth. From time, okay, it can be multifactorial, biological. People, there's strong evidence that show that people who have somebody who abuses or is dependent or has an addiction problem, okay, has a higher risk of having also the same problem than ordinary people in the population. Okay, so, and even in twins, they discovered that there's genetics involved in that. Apart from that, families, you know, sometimes not only genetics.
It could be hereditary.
that's genetic, that's hereditary.
Yes.
But then in family, if someone's father was using it, it's easily acceptable, easily accessible. So it may not only be genetics, modeling too. You see, especially if that father is successful, he was smoking, drinking, he want to follow your dad, you won't see anything.
Father's footsteps.
Yeah, so it's not only genetics, also, environmental factors as well, modeling.
Dr. Kanu, I can tell that the conversation will get more interesting while we talk about illicit drugs and your mental health. Now, for the benefit of those listening at this time, when we look at the theme and we look at our focus today, talk about illicit drugs and your mental health, there are two things involved. First off is illicit drugs, of which to some extent you've been able to define. Now, the other thing is the mental health. You are a doctor from the Department of Mental Health here at the General Hospital. Tell me, how do you define mental health? What does mental health mean to you?
If you don't mind, I've not actually also defined illicit drug. Okay, if you don't mind, because I have issues with that even term illicit. Now,
Yeah, because I was going to ask you.
Because fine, illicit. It's an adjective. It connotes something that is outlawed, forbidden. All right, but not all these substances are
illicit,
are forbidden. Okay, so for instance, alcohol now is accepted in some segment of the community. People use it. It's part of alcohol wreaks havoc. So not all of them are illicit. I prefer. So illicit there is a misnomer. Even those that were illicit in quote earlier on are being accepted elsewhere, like cannabis being accepted elsewhere, in some climb. So I prefer a broader term. That word is called psychoactive.
Psychoactive.
Yeah, psychoactive substance. And that term refers to any substance that has ability to affect the central nervous system. All right, central nervous system there, is simply the brain. All right, any substance that has that can affect the central nervous system. And because when people this means that this drug, when people use them, they have ability to alter the function of the brain with time. They change we are controlled by chemicals. They change the chemicals in the brain. It's a matter of time. All right. So any substance. So all right. So back to your question. You said, what is
mental health to you as a doctor? What do we mean by mental health? Who are those that we can actually say this person is mentally healthy?
Well, there are many definitions of mental health.
Okay.
But simply put, is ability to function properly, physically, mentally, psychologically, and otherwise. Ability to coordinate, ability to be able to bounce back from little stressors. We face adversities every day. Ability to, it's not any little thing you crumble. Ability to withstand certain pressures. There are some that are not. Ability to be able to conduct one's activity, be able to think well, that's cognition, feel all right, the feeling, emotion, and behavior, act right.
Be conscious. Being able to be conscious.
Well, consciousness is another thing. It's not of it. Consciousness is more than what you're just saying. So, ability to function. That's of course, person must be able to function. There are levels of functionality. What one is expected to do, his family, at work, at school, all that. So, when mental health is affected, people are not able to function well. Ordinarily, people just notice there's something going on here. Something is wrong. Even sleep becomes a problem, and what have you. So mental health. Now, so it's an illicit drug and mental health.
Mental health.
Is there
bringing them together?
Yeah. Is there a correlation? Yes, strong correlation. If from what I said earlier on, all right, there is a relationship. Fine, some people will say which one is a cat, which one is a horse, because it's been discovered that people that have mental illness, themselves, are overrepresented among the population, among the people that use drug or abuse drug, are addicted to drug. Also, people that are dependent on drug or have drug addiction, also will develop mental illness along the line. You understand? So which one?
Which one
comes before the other? Now the thing is, take for instance, I was trying to say that by definition of those substances, that means they have ability to alter things in the brain. All right. So when they have ability to alter things in the brain, it means that with time, the part of the brain that is so altered won't be able to function, okay, adequately. The simplest thing that we do involves a lot of chemical activity. Okay, we do this, hear voices. I hear a sound. If I make a sound, this sound, something takes it to my brain to interpret. Okay, something interprets it, send it back,
and there's a reaction to it.
So everything, but when there are things that have altered those chemicals that does those things seamlessly and smoothly, there will be problem. So when people, okay, start using substances, okay, and these substances alter those chemicals. These chemicals are called neurotransmitters, okay, dopamine, serotonin, all right. When they are so altered, it will be, now before you know it, somebody who abuses substance may start having, okay, nobody is talking, okay, start hearing voices, because the part of the brain that modulates that have been altered. There are some substances that do that. Cocaine can do that. Cannabis, popular marijuana, can do that. Okay, the psychotic symptom, okay, can do that. Okay, there are other substances that, will affect the feel-good chemical in our body, like serotonin. All right, they deplete it while increasing other ones. So before you know it, people that take alcohol, okay, for a long time, before you know it, they lapse into depression. They overrepresent. People that take alcohol have more than 40% risks of having depression, or have been found to have more depression than people who don't take alcohol.
I'd like you to take that again.
I said people that take alcohol. Okay,
yes.
Okay, let me be clearer now. Heavy, prolonged use of alcohol.
Okay.
Okay. Have been found to have, depression like 40% more than those who don't take alcohol. All right. Okay. So, because the chemicals in the brain that make us feel good, I can say our specific serotonin, have been affected by alcohol. You understand? So they will affect when alcohol does. So alcohol you're looking at alcohol is very dangerous, but it's acceptable. You say, okay, you can illicit. That's why I didn't like that. Illicit. Social people just carry. You see young people, sometimes they have something in their hand all the time, they are drinking. Some people don't even frown at them. Alcohol can be very dangerous. Alcohol can affect, can decimate the physical body. Okay, from the brain, for the body alone, everything from mouth everywhere. Okay, any organ in the body, alcohol can affect it. Okay, alcohol can cause cancers. Alcohol can cause liver problems, including cancer. The alcohol can wrought a lot of damage in the brain. All right, so it's not illicit. I just gave you an example.
Yes, I like the fact that you used you replaced the word with psychoactive substances.
Yes, that's more acceptable. All right, so there is an incontrovertible relationship, evidence between use of substances and mental illness. Now, as I was I alluded to before, one thing just came to my mind.
Okay,
I once had a patient. Okay, a young guy, undergraduate. Let me not mention the school. Popular institution in Lagos. Popular that any teenager would like to go. Okay, this guy had an unfortunate incident when he was about 12 years. He was with his father alone. Thank God for him. He was at the back seat. The father was in front. The father was involved in a fatal motor accident. North Africa. The father died on the spot. So this guy was behind. Okay, came out largely unscared. No obvious wound. People were happy. Nobody knew that this boy, what he saw at that age, everything was so traumatizing for him. It was damaging. Everybody, they moved their hair, buried the father and all that. But this boy was scared. As he was growing up, he kept having he developed post-traumatic stress disorder. When he sleeps, he just wake up shouting. He saw everything will come. He begins
to recall them.
And he didn't bother. Maybe I don't know whether the relatives didn't know or they didn't know better. So this boy was now growing and after secondary school, when you got to senior secondary, some of those more wayward people, what is this thing? Say, come, we go. They introduced this guy to cannabis. Before you know, he became addicted to cannabis, taking it so much, added other things. So I saw this boy when he was now 28. Has developed frank mental illness, schizophrenia. So he was before he came to he was transferred to us from another facility. He was very violent, very destructive, threatening the mom. So, but after initial sedation, first he was brought by soldiers.
Wow, it was that bad.
Yes. So, but after initial sedation and everything, do you know, maybe, with training, you know how to get into their skin, show empathy, all that. So this guy started crying, telling me what he went through. Nobody saw his father die. He saw this, so when you're able to reach them down there, how? So he started talking. Is that how you started this? Okay, what happens? Is it I needed help? Nobody knew. Nobody cared about him. So he started his drugs. Can say there was something to medicate. Was I say medication? Medicate the experience he was having. So in his case, he had already developed mental illness. That was mental illness going on.
Yes.
Mental illness is not only those you see on the streets.
Exactly.
The commonest ones don't show like that. Depression and anxiety. Somebody that have depression, you may not know the person commits suicide. That's why everybody should be open. So, all right. So that's why I said you don't know where to put. Is it to put which one comes first? Like majority of young people that also start using alcohol, some even cannabis, they have social phobia, a kind of anxiety disorder. They can't stand in public. They can't stand to talk to girls. All right, so they want to use things that will make them feel bold. Before you know it, they are hooked because one thing about there are multifactorial reasons why people now develop addiction, dependence. One thing is nobody starts something and wants to have problem with it. Two things. There's something we call operant conditioning. Fine. Something psychologically where people there are things that when they take the drug, how the drug makes them feel that they like. All right. So they continue taking it even when
they have that first feeling they want to always have.
Yes, they want to always have. Though I'm not talking of tolerance there. They want to go back to it, despite the fact that even when they are noticing problems from it, but they still want that feeling. So that's positive reinforcement. But there's also, conversely, there's negative reinforcement. When they use this thing so much and for a long time, and if they want to stop or reduce the quantity, they have kind of negative reaction. We call that withdrawal symptom. That's physiological withdrawal. So they want to go back to use it to avoid the negative reaction they were having. All right, like those that are addicted to alcohol, when they reduce or want to stop momentarily, they may have tremors, they may have seizures, shakes. Maybe you've seen around anywhere village, those that early in the morning, first thing they do is to take alcohol. They are addicted. Because they are drinking, before they went to bed. When you're sleeping, you can't drink. So when you wake up,
you resume back to work
level of alcohol has now dropped. So they don't have withdrawal symptoms. They are shaking. So they want to go back. That's one of the things. Eye-opening. The other thing. So that's why they continue. They need help. They need help, and there are a lot of things. They need help. Fine. Prevention, treatment. There are fine. A lot of mental health physicians are traveling, but there are good people still around their facilities. Fine. I'm just talking generally.
Yes.
There are faith-based. I'm also a faith person, so I'm not criticizing them. Faith-based association, NGOs that want to help. With this. Sometimes they say they want to just pray alone. They don't want to bring a doctor or psychologist. Fine, they do what we call cold turkey. You don't they make sure they put you where you can access these substances. You don't do anything. So you experience all the withdrawal symptoms. That can be dangerous, especially for alcohol and some other benzodiazepines and all that, because those withdrawal symptoms can be severe. Somebody that is addicted to alcohol, somebody using alcohol for a long time, you can't just put in talkie. And we have had, I won't mention the name of also the faith-based. Okay, we have people who go there when, okay, during the withdrawal symptoms, they have seizures. Therefore, they hit their head, they complicate the problems.
And it get worse.
Yes. So it's also an opportunity to call out to maybe the government agencies supervising this, supervise them and make sure they have experts visited, or they are working with experts, because some of them cause problems. I know they are trying to help. So
Dr. Kanu, sorry to cut you there. Now, I want us to talk about when we say the mental health and then we say psychoactive substances. To some people, they do not even see it as wrong or harmful. Some believe that I am feeling fly. That's the word they use these days. I'm feeling fly with these drugs. Now, let's look at it medically. Some of the dangers, the harms that it causes to the human body system. This will be for the benefit of those that are perhaps already in this and are not even sure of how dangerous consuming all of these substances into their body system could cost them. So let's talk about some of the dangers, the harms that are attached to taking these psychoactive substances.
Yeah, that's what we've been doing. There are many dangers. There are many using psychoactive substances can affect, people adversely. It can affect them mentally, physically. It can affect them socially. Now, of course, so let me start with social. When somebody is addicted to a substance, and of course is not able to meet up with what's expected of him at work, or that most likely the person will lose their job. And with that, you know what will come? Economic hardship. The person is married. You won't have anything to fend for your family anymore. A lot. Then you have interpersonal relationship problems with your spouse, with your family. You're always quarreling because you're not doing the right things. You're spending a lot of money. These substances are expensive. All of them. Is it alcohol? Is it maybe it's only the ordinary the board that is maybe cheap? The expensive brand, the loud, all that, they are very expensive. Is it crack? People sell everything, so it affects it wrecks them financially. All right. Then of course makes them poor. Then people that inject, they are injectable. Crack cocaine, cocaine, the pure form. Cocaine is injected. Heroin can be injected.
There are some that they sniff.
So those ones, there is even prescription injection that we use. Synthetic opioids, pentazocine. All right, and it's an opioid. You see, these ones is pathetic. The way most people, the people that develop addiction to this pentazocine, is pathetic. So those that have sickle cell, they have this pain crisis all the time, and if all they care about is just to stop pain. So if you may not blame the health worker taking care of them, if they get to find out the drug that isn't to relieve the pain, anytime they have, they go and use. And this thing is addictive. So, and this you find even those that don't have sickle cell disease. Health workers, doctors, nurses, because they can easily assess this thing. They get it. If it causes, you see, abscesses, sores, it destroys their muscles. It's distort. It can cause seizures. Pentazocine, and yet it's not illicit. All right. So they use high. I've seen colleagues. Many. All right. So somebody doing this, of course, affects the family. It can cause death. It can cause death. Many of these psychoactive substances can cause death, directly or indirectly. Cocaine can cause death directly.
Wow.
By because these things are chemical, by just raising the blood pressure and heart rate so much that everything will pack. You understand? There are so many. There are some celebrities.
The system begins to function faster than normal.
Even in Nigeria, that have developed this. Then alcohol. You know, in this country, we don't take it seriously. Abroad, they frown at, you know, drunk drivers, because you're not only a risk to yourself, you're a risk to others. You know, so that one indirectly causes death. So it's and these are things that can be avoidable. All right. Then HIV, AIDS, hepatitis, for those that are using using injectable forms. All right. Those are using injectable forms, hepatitis and HIV have been found more in them. So they need to be educated. You know, some of it, sometimes when you want to rehabilitate them, something, instead of maybe cutting it off immediately, you do what we call harm reduction. Okay, let's start by making sure you use good needle. Don't share needle, because they don't care. You know, this one, they share needle in their joints.
They just pick up needles and then they use.
So if somebody that uses a needle has any disease and use
automatically
order. And apart from the fact that beside the fact rather that when people are high, they now become indiscreet in their decisions. Their judgment is impaired. All right, they can risky sexual behaviors and other social behaviors, opening themselves to all sorts. You understand, of health risks. So, and a lot.
Okay, thank you, Dr. Kanu. I want us to talk about stigmatization, because you also said something in line with that earlier, but I want us to focus now on it. To those of you just joining us, this is The Issues on IKD 106.1 FM, and you know how we do it every Thursdays on The Issues, where we talk about healthy conversations. This is also in line with General Hospital Ikorodu. Today, we are talking about this illicit drug abuse amongst our society, our community. This is in line with the United Nations International Day Against Drug Abuse and Illicit Trafficking. Dr. Kanu, let's talk about what we call stigmatization. It is very natural in this part of the world that you see a man, a woman, a teenager, or a youth who is addicted to drugs, addicted to drinking, smoking, and whatsoever. And naturally, people will just stem them as irresponsible. People will term them as people that are not worthy of associating with. Now, doctor, tell us, when we talk about stigmatization amongst these people that are involved in drugs, what do you have to say to it? Do you feel it is actually fair for us to sideline them from our day-to-day activities, or see them as people that are not normal anymore?
Well, you know, that's part of the theme for this year's World Drug Day. By definition, stigmatization is the act of treating someone or something unfairly by publicly disapproving of them. Okay. Of course, stigmatization cannot help matters. Okay, cannot help matters, because you are those that are addicted to these things, they need help. Okay, they need to be drawn closer. All right, for them to have a sense of belonging and what have you. But there are different types of stigmatization. You'll be surprised that the first type of stigma is self-stigma.
Wow.
Those ones, when those people, okay, when they notice, whether it's boils out of the fact that people are already started stigmatizing them, they isolate themselves, they think they are not good and all that. Self-stigma, public stigma, professional stigma, and institutional stigma. So it has to start from the home. Now, whilst in order to prevent addiction to psychoactive substances, family is important. Okay, when the child is still young, okay, parents need to monitor them. Parents need to know where your child is all the time, as much as possible. Not really being autocratic, not really being very strict. You can do that in love. Okay, monitor them, all that. Lead by example. If the parent was okay, was permissive, they know parents can tolerate this. Okay, they will know. But if they knew ab initio that mother, father doesn't like this, that. Some of us, those are things that made us You know, I couldn't afford to. All right. So I mean, I can't afford to. I couldn't have, afforded to see smoke or do anything in front of my dad. Not that he will beat me or that he will cry. He say, "Where are you coming from? Who are you sure I'm your father?" so it's important. So we'll start that early. So, but when the deed is done, I don't want to use damage there now, because still, okay, when the deed is done, okay, the father shouldn't, out of anger or whatever, okay, send the person now, be totally hostile, be nonchalant about their behavior or their welfare. No. That's when they have to draw them closer, encourage them. Okay, I'll walk through you. Okay, I'll give you a lending hand. We are going to do this together. We are going. Very important. Now, because just like in every other, okay, every other part of mental illness, you know, nobody likes to be stigmatized. Nobody likes to be treated specially.
True.
Nobody likes. Just self-respect, empathy. Self-respect, empathy is important. NDLEA, self-respect, empathy. I don't have anything against them.
I understand, and I like the fact that you talked about them looking at angles at which they could create centers that will help those people that are involved in this act. So, Dr. Kano, now I want us to look at those that are already involved. You have said it, and I like the fact that you talked about people should not stigmatize them. There should be self-empathy, and there should be love. There should be a proper means of communicating with those people. Now, medically, we have people who are involved in this already. Definitely, there should be a solution to the fact that they are already in this pool of drug abuse. So tell us, medically, what are some of the ways at which one could snap out or one can escape this addiction, or is it a thing that you have to die with? Are there people that have, or do you have experience from your wealth of experience as a doctor? Have you heard of people that actually escaped or survived being abused by drugs, and they stopped taking alcohol, and they will just tell you that, doctor, I used to before, but now I have stopped totally?
Sure.
Do we have cases like that?
Yes. It is difficult.
Okay.
I said prevention is better. Prevention is better. When I say prevention, primary prevention, not being addicted, okay, is better, like anything, okay, because the other thing is now damage control, secondary, depending, and tertiary. Now, the thing is, with people taking alcohol, if you remember our initial conversation, okay, when they present, no, not alcohol, I mentioned alcohol, we're taking substances generally. Okay, with time, when they present, okay, let me make it clear like this. There's nobody with addiction problem that has only addiction problem.
I would like you to make that clear.
Usually they present with other problems. We call them comorbidities. All right? There's none. Okay? It's either that they had one form of mental illness or the other, or they develop one form of mental illness, okay, after becoming addicted to a substance. So they have sometimes 2 diagnoses, sometimes 3 diagnoses. So you go to competent medical professionals, okay, those who specialize in that, they tease it out, all right? Tease it out, okay? When they present, you do your initial assessment. No, everybody, okay, is every treatment is individualized. You know the patient's need. Why did this person fall into this? Okay, how do you help the person? And as I said, also most times we discover also if they are medicating. Okay, there are issues they have in their life that they can't afford to cope with the reality. They can't. So sometimes they numb themselves with these substances so that they're always there, they're always high. So you need to, okay, open everything up to them, tell them it's possible, give them supportive therapy, but a lot of therapies, all right, CBT, all that. But now, so initially when they present, you do the comorbidities if addressed first. The person is depressed, anxiety disorders, or has psychotic disorder. So this you manage with drug, and other forms of psychological treatment. You do that, then you now start the real rehabilitation.
Okay.
It is not easy. The minimum duration of rehabilitation of drugs, minimum all around the world, because the world is a global village. You have standards, guidelines, all right. 3 months. Minimum for real drug rehabilitation. Each month is spent on something. Okay. You separate them from using the drug, what we call detoxification, because for most of the substances, it takes about a month, 4 weeks for the body to completely get rid of them. All right. So you do that. Then second month, the real rehabilitation. All right. And there, because first of all, most times when they come to you, you are not the one that made the diagnosis. It's their relatives.
Yes.
They may not know everything, but they know this guy has a problem. All right. Has a drug problem. So they say, okay, he is doing this, he is doing that. Okay. So when you do the first stage, okay, you now start the real rehabilitation. A lot of stages. There's something. So many times, I said the other thing to say this. Many times, the person, in the problem, the person that has addiction problem doesn't believe there's a problem. Okay, exactly. He just says, these are the people worrying about me. These are the people.
Yeah, the ones stressing my life.
The least they will say, okay, I'm here because of my mom, because of my dad. I don't want to disappoint them. All right, but we know that in psychology, we believe every behavior, all right, every behavior can be changed. All right, anything you're not born with, even things you're born with, they are acquired. So you will learn them. That's the word. We'll learn your behavior. You learn them.
Yes.
Those people that smoke didn't come out from the womb with
smoking,
with cigarettes. So they learn them. So it can be it can be unlearned, but it requires a lot of willingness. You can't force. They say you can take a horse to the river, can't force the river. The
horse to drink water from the river.
Very important. So during the rehabilitation process, you have to come to a place where the person now, accepts, you're on the same page, accepts this is a problem. Okay, I need to start doing something about it. Unless you get there, they may be there 1 year. They'll go back. They'll go out that same day. They
still go back to it.
That's so it can be frustrating for the health worker, for the practitioners. Very frustrating. Is I can say in my experience, I don't know about other mental health physicians.
Yes,
treating drug addiction is the toughest. All right. So it requires time. Most times they don't. Sometimes it happens, but most times it doesn't. Not in one admission of 3 months. No, they have to come back. Because some of them will be overconfident. I'm going to do this. Don't worry. I know. You go out there because now the secret of, by the way, helping them staying abroad. Sometimes they can do it from home. It's more difficult whenever they crave. It's difficult to control. They can go and take, but when they keep them somewhere for it takes a while to form a habit. It also takes a while to break the habit. Okay, you help them find substitutes, help them find way, because whilst they were addicted to this drug, there's something called primacy. They've left other sources of pleasure and activities, and they spend most of their time doing this. So you need to help them identify. First, identify the triggers, why they started this in the first place, and they'll help them identify. Some of them are internal, some are external. The internal ones you try to change, maybe easier to change. External ones, if it's their environment and their friends, and they built a house somewhere, and people that they smoke with or drink with house, you can't ask them to relocate.
Definitely.
It's difficult. Some of them are able to do that. So help them identify, take them through process. It's a thorough, elaborate process. All right. So, okay. Okay.
Then I wanted to ask you, Dr. Kanu, that with your wealth of experience here at General Hospital Ikorodu, have you seen cases of people who would voluntarily, you were given instance of the intrinsic motivation that is coming from within. Have you ever had any experience of a patient who will come to you and say, Dr. Kanu, please, I need your help. Enough is enough. I want to stop this. Do we have cases like that?
Yeah. Yeah, it will appear so when they come to you, but eventually you know the reason. Some, their family, maybe their mom, begging them, no matter how old the person is, mom is alive, coming and crying, okay? Some their spouse, some their children. For instance, I had someone I recently managed a lawyer that had been taking alcohol. He will tell you, if I want to stop this, I'm addicted. When I want to stop, I stop. I can say with 1 week without taking it, 2 weeks. I thought, okay, what now happens? Say when I want to take, I won't control myself. I was so now. So at some point, this guy started when he wanted, because the wife was talking to him, the mom was talking to him. The father was alive, not addicted, talking. He started to try to reduce. He started having seizures. At a point, he had seizure. And I hit his head on the floor, hit iron. So they carried him to one big hospital in town. I won't mention the name. And they are busy they couldn't even do proper clocking. No, there is a background problem of alcoholism here. They are saying he had a stroke.
Wow.
So I lived there for a while before he came. So when he came, he said, I'm done. I don't want. I'm done. If this thing is going to take my life, they were warning me. Okay. So his own, a lot of things, environment too. All right, I think drinks with friends. I think the wife drinks also, but right.
Okay. So, Dr. Kanu, because time flies, it's quite unfortunate. We have less than 10 minutes to leave the studio. I want you to tell me for a fact, for those listening out there, and they feel like, okay, the doctor has actually said, well, I want to take a drastic change. Are you saying the doors are open for them at General Hospital Ikorodu for those that have abused to some extent? Are there platforms at which they will be well attended to, if at all?
Yes, of course. You come to General Hospital Ikorodu, you will meet people in the department, including me.
Okay.
But I said addiction therapy, rehabilitation requires a long time.
Okay.
We can start. Okay, we can start. And then we'll direct you on what to do. There is help.
There is help.
Yeah, there is help.
There is help.
Yes.
Okay, so Dr. Kanu, I don't know if we can take 1 or 2 calls for those of you that would have questions at all. We have very limited time. If you want to do that, you can call in on 0904081061 or 09040821 1061, where today we focus on illicit drugs and mental health, which was well classified by Dr. Kanu as psychoactive substances that affect the human mental health. Now, I want you to advise our listeners out there. Let's combine both those that are users and those that are not even yet into it, because some people might just find themselves in it one day, which we don't hope for. What would your advice be to those people? But before then, let's take 1 or 2 calls. Hello to you.
Hello.
Yes. Good morning.
Good morning.
Your name, please.
This is Madam Yusuf calling from Igbogo.
Please talk to me real quick. You have just 1 minute.
Exactly.
Yes.
Sincerely, I need to appreciate the doctor we have. He has touched every state.
I agree with you.
Causes of drugs. But most important is that the community sometimes they don't help. Drugs are available at every particular time, at every particular place. It is very easy for people to get it and use it. If the community leaders can help, because if they come from one house to another house, we see them say, most especially alcohol and tobacco. This has really affected most of the youth. They cannot think straight. They cannot do anything. They cannot be productive. Please, if the government can help, and even in the garage, the government will be saying, "Don't drink, when you drink, don't drive." And in the garage, they are selling. Every car wash, you will see them selling. When you take your car to go and wash, you will see them. They will be selling beer. They will be selling all these things. And when they are washing your car, they are selling. After selling, you go back to your car and drive. So the government the FRCN and the community.
The community.
Because we need to help people with this that are addicted. Some of them is not intentional. Some of them is something, according to the doctor we have in-house,
Yes.
it's something that will lead to this. It may be an emotional thing. And I also advise company owners, these days that things are hard, they should get a medical practitioner that really have to talk to their workers, because most of them are not stable, so that they could be able to get perfect output from this. Thank you very much.
Thank you very much for your contribution. I think I also would agree with that which he said.
Very good point he made.
Honestly.
Very good point.
Honestly.
Availability of these substances everywhere.
Yes.
It's not helping our youths. It's not helping. I don't want to say we're a lawless country. No. I don't want to say that loosely. But it could be better for everybody if stricter laws are made.
Okay, let's take another call before we leave. Hello to you. Good morning.
Good morning, sir.
Yes, talk to me. What's your name?
My name is Mr. Aladubela Tampa.
Okay, talk to me.
About this drug matter you are talking about,
Yes.
it's what I go through in my life.
You as an individual. Yes.
Those people that are taking drugs, then you should bring them closer to us, counseling them, let them know that what they are doing is bad. Are you with me?
Yes.
Then they should not be thrown away. Like myself now, like I should throw away now. I cannot get my life again. So they need to bring closer and talk to them.
The doctor wants to talk to you. The doctor needs to talk to you.
Not that I tell you that take it.
No, hello, can you hear us, sir?
I'm hearing you.
The doctor wants to ask you a question.
No, there's something he said. He said he's thrown away, cannot have his life back. Did I hear correctly?
Hello?
Did he say he's thrown away, he cannot have his life back? What did he say?
Do you say you are neglected, sir?
Yes.
I say I'm taking it before.
Okay.
When I was young.
Okay.
So it's later that I realized that what I'm doing is bad. Even my papa take me to a doctor.
Okay.
The doctor told my papa that nothing wrong with my brain, but they should take me closer and be counseling me before I get myself back.
Okay. Fantastic. That's good then. That's good news.
Thank you very much.
Thank you very much for your contribution, Doctor. It's quite unfortunate we have to leave, but then your advice, please.
Thank you for this opportunity.
Yes.
I'd like to tell the youth out there, you don't need validation from anybody. You should have self-confidence. You don't need to belong to any group, okay, to have a sense of belonging. Okay, any peer. What is good is not good. Nobody was born, with any other person. You come into this world, you have your destiny. Don't listen to them. Don't focus at what you need to do. Then those already have this problem, okay, it's not the end of the world. Seek help. Okay, don't die in silence. Seek help. Go to the right places. Come to General Hospital. If you're in Ikorodu here, go to teaching hospital. Talk to doctors, talk to psychologists, go to the right person, okay? Seek help before it becomes too late.
Thank you so very much. This is how far we can have it today. I want to say a very big thank you to you, Dr. Isaiah Kanu. You did justice to the conversation, and I must tell you that I learned a lot on this conversation. And of course, to all of our listeners out there, I apologize that we could not take in all of the calls. I sincerely apologize. Our time is fast spent. Let's do this again tomorrow on the issues with Gift of Bona, where we talk about germane matters around our nation. God bless Nigeria. God bless Lagos. God bless Ikorodu. And God bless everyone. It's a bye for now.